Thank you. Thank you very much. I hope you can hear me because I'm hearing myself with an echo. Maybe from the translation, but I don't know. I will try to speak, and I thank you very much for this invitation. I'm really, really sorry that I couldn't be with you. And thank you to the foundation, to the Harriet Joyce Foundation, especially to Jeffrey Himmel, with whom I got acquainted with through Richard Deckelbaum. And as was said before, Richard is with us, I'm sure about it. Thank you. I'll try to be fast because I know you're behind and I don't want to be between you and food. So I'll try to be fast. What I would like to actually highlight, adding on to what was said earlier today, is the issue of social determinants of health. And I want to argue that social determinants of health should be actually much wider and with a wider scope. It's not only the socioeconomic status, the family and household well-being, education, physical environment, employment, etc. I would like to also mention food systems, including food security and One Health. The social determinants of child and women, pregnant women, and I agree with those who mentioned it earlier, child and pregnant women health, well-being should really be approached in a holistic manner. We have to understand the fact that the conditions that are social determinants have to do with something that is so important in our society. It is about equity, it's about improving the overall population health, making all the services accessible to all. This is very important. The One Health approach, which I'll mention shortly, is one way to look at it in a wider way. Indeed, we are all connected. We are all connected across the universe and with diseases. And when we look at the One Health approach, we are actually looking at the health of people, animals, plants, and the environment. And we show that in everything that we do, we are linked, we are connected, and we may bother the balance, so to say. We therefore promote collaborative, multi-sectoral approach that would encourage people to work together and to look at the health of women, children, and also others is a complex challenges that spans over different domains that we all have to look at it. As you can see, the One Health approach is clear and we can visualize it in different ways, but the food system requires a special attention, and you can see it in the other circle here with the food system health that it actually touches human, plant, environment, and animal health. The food system itself is quite complicated. When we look at the nutritional status of food security, we look at the tip of the iceberg or just below the iceberg. But what actually creates the condition for our health is the complex, connected, and adaptive system that has to be done through the production of the food up to the consumption and the nutritional status. Food security is a very important social determinant for child health because food security has to be looked at very hazardous way if it's not done correctly. As was mentioned before by Waida, access to exclusive breastfeeding, yes, with micronutrients, including vitamin D, followed by diverse nutrition and adequate food is important. But how to get it, what to do, and the safety of the food is so important. Our environments, wherever we are contaminated because the people today and yesterday didn't care about the environment, and they made it full of hazardous materials and toxins. Heavy metals are everywhere. Aflatoxins, you'll hear about it later, are also here. The PCBs, foodborne diseases, zoonotic diseases, all of them are in our plate and in our food. Heavy metals are also included in our soil, and soil health is a key thing that we didn't used to pay attention to. You can see here children with hedgehogs. These hedgehogs actually are very good markers. We use them as surrogates for the exposure of kids. They are small, they are pricky, no one likes to touch them, so they are quite good reflection of what is in the environment. And in our studies with hedgehogs and children, we can see that both of them suffer from the same soil diseases that are everywhere. I'm not going to go through this geographical pathway and show you how everything is linked to everything. And at the end, it is the environmental hazards are not only the ones that we drink, we eat, we breathe, we bath in. It's not only that. It actually interferes with our genetics. It has a genetic lens that actually make us these changes in plants, in animals, and in humans. And these are very important issues. I mentioned the aflatoxins, and they are also included and marking many food, as you know, but also impact the health and the health system as a whole. What we understand is today that we have to nip it actually at the bud of these aflatoxins. Look how it looks so beautiful, but it's awful. As I said, you'll hear about it later on. The food and gene environment interactions and their impact are clear. Genetic factors are doing all these interactions and result in autoimmune diseases, in inflammatory disorders, cancers. And now people are speaking about genetic formation during malformation during pregnancies. The gene environment and food can come from ingestion of contaminated food, water, breathing it, taking care of it, and it comes in many shapes and forms. And it was important for us to mention that point because it's the nutrition quantity, but also safety that counts. The microbiomes, which are really a hit now in the research arena and food production, they can also serve as indicators for others. There are different works that reveal it, that food safety risk assessments can go deep into the microbiome. So what to do with it? What to do with it is actually to pay attention to the holistic approach and to improve maternal and child health through a holistic perception, reimagining pediatrics into the social focus that we are used with the SDH, with the social determinants of health, but also to add to it determinants of environment, agriculture, education, community-based approaches, and to look at the whole food system from A to Z, and to understand that in order for the next generation to be healthier and to be able to understand, we will have to invest in research and in the know-how. Building the environment will impact child health. We see it already in communities that invested in it and have done it in the right way for a long time. One of the ways to do it when we start bottom up is to work with what we call prescription for action. Doctors, pediatricians, family doctors, public health, and others can actually look into a specific prescription for a family, for a household, for a child, for a mother, and to actually try to say to them, where do you live? What kind of soil do they have? What can they grow in that soil that won't get full of arsenium or other heavy metals? And what they can do with animal products and others. Treating the whole environment and not only the individual is very important. And that brings us to community work on food and empowering local communities in order to be sovereign, meaning not to depend on external market forces. External market forces are those that feed us with food that not always is the right one. But if we take care with the communities, also grow flowers, not only food, but create a balanced approach to our garden, would help us. The call and the prescription for action promotes local agriculture, cultivate community gardens, and cooperative kitchens, including culinary circles that look at it. This is my last slide, and I like to end with it because it shows the Nordic. I lived some years in Denmark, and I don't know if you know that the Nordic people in the past, the Vikings, used to defend themselves in kind of a circular sphere shape, meaning that they were all standing and covering themselves in a sphere so that nothing could have gotten inside. That means that if we work together as communities, as individuals that hold our destiny together, nothing could go in between us and harm us. But for that, we need a community action and top-down, bottom-up approach that works all together. Thank you very much.